So with the lap band procedure, it was the doctors in Mexico that trained the doctors in the United States. And people would see my surgery, which I had gone to Europe. I had gone to some of the doctors who had developed it in Frankfurt, Dr. Weiner, and they would write to me and say they were having the procedure. And I would ask them how many times the procedure had been done. Or the doctor, I'm going to be the first one. Or the doctor has done it twice. And the doctors were being trained by the doctors in Mexico because you had been doing it down here for 3 years. So we, as consumers of our own health care, especially with something that we're going to be paying for outside of insurance, out of pocket, or cosmetic procedure, where there's no rush, there's no, it's not emergency, oh, I have to have emergency facelift, I can't look this way for 1 more minute. It's not cancer, it's choice.
Mm-hmm. Mm-hmm.
And if you can find a better outcome that's more minimally invasive, that costs you less, that takes less time to recover from, this is a win-win-win. And you should look for those procedures close to home. If they're not available for the right price close to home, you should open your mind to expanding your where you're willing to go, and consider medical tourism, consider traveling to have a procedure.
Yes, we are able, our Board of Health allows us to get any medication, any substance, any technique from a valid study that has been conducted, for instance, in Europe. So we are able to get any of those items right away to the American patient 5 minutes from the border. So it is important for you to know that you're not going to go into a jungle, you're going to come into a city and 5 minutes from the border. So at Artface, we will be waiting for you and waiting to hear from you.
And I will be following up after a few weeks, a week go by, and tell you how things are going. I'm going to my son's wedding, and I'm ready to make everybody feel really jealous. Thank you so much for watching, and I hope you all learned something from this. And thank you, Dr. Ruiz, for taking the time
to talk
to the woman at OBGYN Net.
My pleasure.